Assalamu alaikum guys, hope you are all fine. So today we will discuss about the left coronary artery. So today our topic is the left coronary artery. In the previous lecture we will discuss about the right coronary artery. Now we will discuss about the left coronary artery. Left coronary artery is actually originate, or we say that arise from the left aortic sinus. As you can see here, left aortic sinus of the ascending aorta. What is left aortic sinus? In the previous lecture we talk about it, but now we will repeat it. Left aortic sinus, aortic sinus is actually the swollen part of the ascending aorta. This is the aortic sinus. It is a swelling part of the aortic sinus. It is divided into two parts. The one is the anterior one and the other one is the posterior one, which is on the posterior side. Right coronary artery is arise from the anterior aortic sinus, and the left coronary arteries arise from the posterior aortic sinus. But posterior aortic sinus further divide into two parts, the right one and the left one. So left coronary artery is arise from the left posterior aortic sinus. So this is the important point. It is arise from the left posterior aortic sinus. Left coronary artery pass between the left auricle and the left side of the pulmonary trunk. As you can see here, it is in the coronary circus. This is the coronary circus. It is passed between the left side of the pulmonary trunk. This is the pulmonary trunk, and the left side of the auricle. This is the left auricle. Okay. In approximate 40% of the people, the SA node branch, which is arise from the circumflux branch of the left coronary artery, but in 60% cases arise from the right coronary artery. The first branch which is arise from the right coronary artery is the SA node branch, which is 60% from right coronary artery, but in 40% 60%, but in 40% cases it is arised 40% cases it is arise from the left coronary artery. Okay, got it? As the left coronary artery enter the coronary circus at the superior, you can see here, superior end of the anterior groove. You can see here it divide into two branches. One is the circumflex branch, which is the smaller one, and the larger one is the anterior interventricular branch. You can see here. First we will talk about the anterior interventricular branch. Anterior interventricular branch is the it is called anterior interventricular branch because it is moved in the anterior interventricular circus. Okay, how we say groove. Anterior interventricular branch move downward into the anterior interventricular groove toward the apex. This is the apex, toward the apex of the heart. Here it turn around the inferior border. Here it turn around the inferior border of the heart and anastomose with the posterior, and anastomose with the posterior branch of the right coronary artery. This is the posterior branch of right coronary artery. As you can see here, I'm gonna focus it. Sorry. Okay. Posterior branch of the right coronary artery. This is the anterior interventricular branch. And now we will talk. Okay, one important point is that during it course, one or two diagonal branches may arise. You can see here, this is the diagonal branches may arise and descend diagonally across the anterior surface. This is the anterior side of the heart, anterior surface of the left ventricle. This is the left ventricle. You can see here, this is the left ventricle. So this is the diagonal branches, and this is which is arise from the anterior interventricular artery. And it is end and terminate by anastomose with the posterior branch of the right coronary artery. It is not false when we say that right coronary artery have two terminal anastomosis branch. The one which is formed due to anterior interventricular artery, and other one which is formed from the circumflux branch. Now we discuss about this left circumflux branch. Circumflux branch is the smaller branch as compared to the anterior interventricular branch. Circumflux branch move in the coronary circus around the left border of the heart toward the posterior surface of the heart. As you can see here, it is move in the left side forward and then wind round around the left border of the heart toward the posterior side. You can see here, this is posterior side. Okay, before it move backward, it give one another branch which is known as the marginal branch. You can see here, marginal branch. This is called left marginal branch of the left circumflux branch. It follow the left margin of the heart and supply the left ventricle. It follow the left margin of the heart. As you can see here, it follow the left margin of the heart and supply the left ventricle. Okay. Mostly circumflux branch of the left coronary artery terminate in the coronary sulcus on the posterior aspect of the heart. You can see here, before reaching the curse of the heart, curse is the meeting point between two arteries. So before it reaching, mostly it terminate before reaching the curse. So this is the small discussion about the right coronary artery. Hope you can understand. If you have any query related to this supply, so please ask your question in the comment box. Thank you.